Hi, everyone. I'm Dr. Diana Bitner of True Women's Health, and we're here tonight to talk about how to prioritize your pleasure. And so we have to be careful with what we call this, of course, on Facebook. And so we've danced around the subject a little bit. But this is Go Red Heart Month. This is Valentine's Day month, the month of love. And so we're really having fun with this and want to talk tonight about how to prioritize your pleasure, how to support your intimacy, and all of that good stuff. We've already had lots of questions sent in before the episode started tonight. And so I want to make this pretty casual and pretty comfortable. So please feel free to put in your questions. I know some people have asked us, are you sure no one can tell that I'm here? So no one can see that you're here unless you make a question or a comment. If you would rather do it privately afterwards, feel free to send us a PM or DM or whatever they're called, a private message afterwards, and we'll be happy to get back to you when we're not live. So, if you have friends who didn't want to watch this because, of course, they were worried about being seen, then feel free to send them the link and they can watch this afterwards. One of the reasons we wanted to also talk about this tonight is at True, we are having an event next week to talk about the Mona Lisa Touch. The Mona Lisa Touch is a laser therapy that is FDA cleared for treating the symptoms of menopause, of vaginal dryness, pain with intercourse. It is a way to rebuild the skin in the vagina if estrogen is not an option for you or if it's something you choose not to do. It's as good as estrogen. And so it's an option that we offer here at True. It's very effective. We've been able to use it in, for women who, again, choose not to take estrogen, or maybe it's not safe for them because they have, let's say, a uterine cancer or advanced stage breast cancer. It's just been a great way for women to reconnect with their partner, to be able to have sex, to not have bladder urgency. And so we're really excited. We already have quite a few women signed up for the event. It should be a lot of fun talking about intimacy here at True Women's Health. So again, you see that on the banner below. So again, any questions, feel free to chime in. Intimacy, pleasure. It's something I could not have talked about 10 years ago. It made me very almost embarrassed to talk about. I think part of it too is that us physicians are not trained in sexual health. And so if someone would ask me about sexual health or intimacy, I would really not know what to say. And so I would just kind of hope y'all didn't bring it up. But now that I've been trained at the ISHWISH, the International Society for the Women's Sexual Health, and have really had a lot of experience talking to women, and sometimes people bring in their partners, male or female, and we're able to talk about it together. I've gotten a lot more comfortable talking about it. So really nothing is off the table, and happy to talk about it. When we talk about intimacy, the first thing that I always like to bring up is what is sex? What is intimacy? And it is pleasure. It is intimacy. It is fun and laughter and joy expressed in individual ways. So I'll have some couples, for example, who maybe have been together for 60 years. They're 80 years old. They don't have great, let's say, sexual desire for penetrative sex. They touch, they love, they hug, they cuddle. And they're like, is it okay that we're still not having sex like we did when we were 40? I'm like, again, what is sex? It's intimacy, it's pleasure. And so it's expressed in all different ways. And I think the first thing to think about is how you feel about this yourself. And, as I've gotten trained, I've been in these lectures from incredible teachers, such as Dr. Cheryl Kingsburg, right? And I'm in these lectures and I'm thinking, how am I going to remember all this stuff? There's such a wealth of knowledge to bring this to my patients. And one of the ways that we've dealt with that is with the sex deck. So the sex deck is something that we're going to introduce tonight. And it's a wonderful tool to use to talk to yourself about it, first of all. And this is the first card of the deck, and it's about improving your sexual well-being. And I think of sexual health as a puzzle. there's lots of pieces that have to be present, not only within yourself, but maybe within your relationship, for sex to be a very healthy thing, to have pleasure. Sexual health is so much more than an act or a physical event. For so many women, it's feeling young. For men, it's feeling young. For people, it's feeling vibrant and part of the self of the, the part of the self that they remember when they felt really good about everything. And so as maybe someone gets busier and they get distracted and not thinking about sex, they don't feel as much themselves. They don't feel this young, vibrant person. So, our goal here at True is that we're helping you live your truth. And we believe sexual health is part of one's truth. For most, there's some. And so it's helping to understand that. So when I first think about intimacy, again, it's to really understand how you inside feel about intimacy. And so when we first start thinking about why women might not have libido that they had in the past, let's first talk about what is libido. So libido, simply defined, is one's desire for sexual intimacy, let's say with oneself or with a partner. And there's spontaneous libido, where you just think about sex. So spontaneous libido is driven by hormones. It's driven by culture. It's driven by, I've had patients who said, they thought about sex, but they were raised in, let's say, a very strict CRC household. Sex wasn't talked about, but they'd sort of see something on TV or see something in a magazine and think about sex and be very curious and feel that their hormones were rising, but very much, we're taught that it wasn't okay to think about. It wasn't okay to think about pleasure, certainly not with oneself, and not. So it became something that was just very confusing. And so there wasn't ever really a healthy relationship developed with spontaneous libido. Like, it wasn't okay to think about sex. Then there's responsive desire. Responsive desire is where a certain cue might get you thinking about sex, and then you want to have sex. So for example, a cue might just be spontaneous libido. You think about sex, or you have a memory, and then you have sex. Responsive desire could be in responding to a cue of your partner. Your partner's like, hey, or whatever cue that you share together about that. It could be a certain song. It could be a day of the week. It's, hey, it's Sunday morning. That's time for sex. It's Friday night. It's date night. Whatever that is, responsive desire. So for example, someone could have spontaneous desire, like they think about sex, they want to have sex, but because of pain, they can't respond to that desire. And so it's important to think about those two different aspects of libido, especially when we get into figuring out why maybe you don't have the libido that you want to have. And then what do we do about that? So as we think about that, I first, again, want you to think about yourself. And as you think about prioritizing your pleasure, it's thinking about why you might not have the same desire that you had in the past. And so, for example, so the first part of the sex deck let me back up. What is a sex deck? It's the 27 reasons for low sexual desire. There is good data and research about all this. It's a very evidence-based tool. And they're color-coded. So they're orange for physical reasons for low desire. And so we can go through the cards. I think that we've got a couple queued up to talk about physical reasons. So one, for example, that's very common that we talk about here at True is what happens during midlife and menopause is low estrogen. Now, low estrogen or menopause can happen at any age. I've taken care of patients as young as 15 in early menopause from cancer treatment. So a woman's in puberty, she goes through through adolescence after puberty, and then unfortunately she had cancer, was treated, and now she's in menopause at 15. Menopause can happen at 32 with breast cancer. It can happen at 52 spontaneously. So whenever there is a loss of estrogen, then it can affect sex drive. Now, women also can have low estrogen if, let's say, they're on the birth control pill. And the birth control pill can suppress that estrogen so low that it makes women feel as if they have menopause. And it's caused by low estrogen. So again, what are the causes of low estrogen? Natural menopause, surgical menopause. We're seeing more and more women who have, unfortunately, what we call premature ovarian failure. And so they have maybe menopause at 37 just because their periods stop, their hormone levels are low, their ovaries not making any more baby eggs, and they have, for whatever reason, hopefully we'll learn more with research in the coming years, but they have premature ovarian failure. And so again, those are causes. So for many of these women, if estrogen is safe for her, and it's safe for many more women than what women think, estrogen treatment can often increase that estrogen and therefore deal with this aspect of low desire. I see a question. Oh, Mindy, I'm assuming estrogen. So another one is estrogen patch. Yes. Awesome. So difficulty achieving orgasm. So I'll have patients who say, oh my God, it takes so long, or it's so difficult to have an orgasm. Like, why even do it? So maybe their partner wants to have sex and they're like, it takes so long. I don't have time for that. So number one, just to bring up the topic, of course, having an orgasm is a good thing. Does it need to happen every time? And I think sometimes people feel so much pressure. And that's one of the reasons is performance anxiety. Is if I don't have an orgasm, then there's anxiety about having an orgasm and it makes it even harder. I've had patients who say, if I don't have an orgasm, my partner feels like they failed. So I feel like I'm trying to perform for them and I can't even relax and just enjoy it. So part of that performance anxiety, are you performing for yourself or are you performing for your partner? So it's thinking about having an orgasm, finishing that experience that way. Is that really that important that it happens every time, especially if it keeps one from, hey, Helen from Australia, so glad to see you. Thank you. So having an orgasm, it can be difficult. Part of it could be lack of knowledge. So let's look at the reasons. Causes of difficulty achieving orgasm. Number one, again, lack of knowledge. Some women think that if they can't have an orgasm with penetration, there's something wrong with them. So I ask most of our patients, are you in the lucky 30? So only 30% of women can have an orgasm with penetration. So if a woman is not having an orgasm with penetration, A, there's nothing wrong. And B, it can be okay to explore on oneself or with a partner what that would take for her to have an orgasm. I had a patient who only had orgasm with oral sex, another one only with a vibrator. And she wanted to introduce the vibrator into partnered sex, but was very shy that her partner would say, oh, am I not enough? And when I told her that there was research that if partners are asked without their partners present, if it's okay if she brings a vibrator to the party, is that okay? And this is, of course, for same-sex or heterosexual partners. And is it okay if she brings a vibrator to the party? And they're like, well, yeah, I just hope that she does it with me. And so sometimes it can be really a good thing because generally, if it's a good, safe, loving relationship, it can be really sexy. It can be really a turn on to see your partner get turned on and have an orgasm. So again, if it takes a vibrator, that's okay. If it takes manual, if it takes oral, whatever works, please use your power and speak your piece. Menopause can cause difficulty having orgasm because there's not as much blood flow down there with low estrogen. So in menopause, if there's not blood flow, just like a man can't have erection without blood flow, women can't have that stimulation or the erection of the clitoris without blood flow. And we need estrogen down there to have blood flow. So really important. The subject of pain, and I'll get to that question. So Missy, please leave it up. But the pain is an issue. I saw a patient recently who has such pain with sex, and she's like, well, and I can't have an orgasm either. I'm like, there's not room in the brain for pain and pleasure at the same time. So I love this question. Is the saying use it or lose it true? My girlfriend told me I should try to have more sex to prevent my pain from getting worse. She said I don't have enough sex and that's why I feel tight. So it's true and false. So let's say that someone is having very frequent sex during midlife into menopause, and it's been a very frequent thing. For some women, let's say 20 to 40% of women, if they keep having sex, sometimes that does really help with the collagen, which is the support tissue of the vagina. And if there's more frequent sex, sometimes that can keep that collagen flexible because there's so much arousal and moisture and good stuff happening, then it can maintain, she can maintain her arousal and her lubrication. But for some women, that change can be very abrupt. If there's a period of time without intercourse, especially penetrative intercourse during the transition, then there's pain, and then going back to having penetration is just very difficult. The other thing that happens is if there's been pain a couple times, then the body is trained to protect her from pain. So, for example, if a woman's had pain, even if we fix the source of pain, let's say we treat the skin with estrogen. And now the skin is okay, but unfortunately, the muscles of the pelvis remember that it hurt. And so when penetration happens, the muscles clench down and essentially say, "What? Get out of here. This is not happening because this hurt last time." And so sometimes it really takes a lot of retraining. It takes maybe using a vaginal dilator to open that tissue back up. It takes treating the skin to get that collagen to be flexible again, treating that skin with either estrogen or the Mona Lisa laser. It's getting the condition better and then retraining those muscles to allow it to happen. Does that make sense? So yes and no. So whoever this was, like, please see your provider, see us, and we can certainly help resolve this. So history of pain with sex. Thanks for putting this up. This is one of the psychological reasons. And psychological meaning, of course, if it hurt in the past, that can make you have low responsive desire. Meaning, I'm thinking about sex. I still think my partner's cute, but it's hurt too many times. I don't want to do it again. And that can really just make you feel like low desire. You don't want to do it. It's not like your body processes it. The frontal cortex is logical, right? I had pain. We solved the problem why I had pain. I'm not going to have pain. But that's logical. But when we go into flight or fight or fear, there's no logic. And so the vaginal muscles are not attached to logic. They're attached to fear. And so if there's fear of pain, they're going to clamp right down and there's no way anything's going in. So again, when a woman has had a history of pain with sex, sometimes, number one, it can be useful to use vaginal Valium. Valium is a muscle relaxant. So if we can give the Valium an hour or so before sex, and then a woman's able to have penetration without pain, we start to unhook the fear and the pain, because it happens how many times? She doesn't need Valium anymore. The disconnection happened, and so now a woman can again have pain. If there was a certain event, a certain partner, a specific position, again, how can we unhook current day from the past situation? So again, it's about having an open conversation. It's about learning different positions that might not cause pain. So for example, not to be crass, but if a woman is having sex in, let's say, a missionary position, she's on her back, her legs are out, her pelvic floor contracts. Maybe if she's on her belly and he's from behind, maybe there is not pain because that position didn't cause the pelvic floor to be so tight. I hope I don't get censored on Facebook for saying that. So, but again, it's just all about knowing what works for you, knowing what works for your pelvis, and being able to have that open conversation. Helen, cushion? Yes, cushion. So poor self-image is another thing to think about. So this is, again, thinking about what you feel about intimacy, not necessarily what your partner feels about intimacy, but how do you feel about this? So many women, for example, will gain weight during midlife and menopause, especially belly fat. And I had a patient who said, I have sexual desire. I really like my partner. We've got a good relationship. But what happens is that I've gained weight in my belly. And when we have sex, he touches my belly and it reminds me that I feel fat. So I said, so that's all it is, that you feel fat and you don't feel fat until you feel your belly touch. She said, exactly. I said, have you ever asked him not to touch your belly? And she said, well, no. So she went home and she did. She said, I'll have sex with you if you don't touch my belly. And he's like, that's all I have to do is not touch your belly? Okay. So they were able to. And then it was also a reason that she became very motivated to increase her muscle mass, increase her fiber, and start, lifting weights more. She was able to get healthier. She felt better about herself. And then their sexual relationship and their pleasure took off again. So poor self-image can be a really big deal. And so sometimes cognitive behavioral therapy, it's thinking, how can I switch my thinking? So I had a patient who had breast cancer, and she had a surgery, of course, to remove part of her breast, and she had a reconstruction, but the scar made her feel very not feminine. It made her feel very ugly. She didn't like it. And she felt like she was disappointing her partner. So for her, it was almost easier to not want to have sex or not have sex than have to think about what that looked like to her or her partner. And so she was able to see a therapist, and she was really able to flip how she saw that in her mind. And she started to see the scars with gratitude, that I'm alive, I'm well, I had a surgery that saved my life, I had a surgery that took out the cancer. I'm going to be very grateful. And I'm going to think about all the other parts of sex that I love. I'm going to think about my partner. I'm going to think about all the other parts of me that I think are sexy. And so she was really able to flip that around, and she became very grateful. And so that's what cognitive behavioral therapy does. It teaches us how to flip a certain thought from a negative maybe to a positive. So self-care is important, yoga, exercise. We know that people who do yoga, they're able to be focused, not distracted. They're able to be like more in their body and present. And that can, again, really help with poor self-image. So again, these are all things I want you to think about in terms of your desire for intimacy. What is working for you. The other things in terms of psychological things, I'll just list off, keep that one up there, would be a history of abuse. And unfortunately, that's a whole nother subject. But of course, if there's been sexual abuse or emotional abuse, then it can be very difficult to be vulnerable. And being in a sexual relationship, having sex, having the act of sex is one of the most vulnerable things we can ever do. And so if you have felt not safe in the past, it's really to examine the current relationship. Do you feel safe, number one, with yourself? Do you feel strong enough to say no? Do you feel strong enough to make a choice in the moment to not give up your power? It's really powerful. And then in that relationship that you're in now, do you feel safe? Do you feel safe that you would speak your mind? So super important to look at. And we have two wonderful therapists here at True, and there are other therapists in town, but it's really to address those things, because that could be affecting your sexual desire without you even thinking about it. All right. So now that maybe we've started to thinking about what intimacy is for yourself, it's to think about how intimacy is between you and your partner. And so there are these many cards, 1, 2, 3, 4, 5, 6, 7, 8 cards that address interpersonal. And so this might affect, again, you might have spontaneous desire, you think about sex, but there's issues between you and your partner that might really affect your ability to be vulnerable, to want to have closeness with your partner. I can't remember, where I heard this, but I just think it's so true. Is, again, it's a stereotype, so please forgive. Stereotypes are not always true, but I've heard it said that men tend to have sex to create a connection, and women tend to have sex to reward a connection. I want you to really think about that. If you might feel there's an unresolved conflict, you might not feel that there's a connection to reward. So I'm going to tell you a little funny story. So had a patient, I don't remember. She was like 63. And she came in and she said, "Oh my God, when is my husband going to stop wanting sex? Because I'm 63. We've been married for 40 years and I'm just over it." I'm like, just a minute. I said, "Do you want to be in an intimate relationship with your husband?" "Well, yeah, I guess." I said, "Do you like him?" "Yeah, I like him a lot. He's my best friend." "Do you love him?" "Of course I love him." "Is sex a bad thing?" "Well, no. But," and so I said, "Tell me something that he has done that makes you feel special." And she was like, "Ugh, nothing." I said, "Come on, there's got to be something." And she said, "He hung the closet doors without me asking." And she got all twinkly. So when you can think about something about your partner that makes you twinkly, that's oxytocin. That's brain chemical that forms bonding. And so it's to think about, there might be unresolved conflicts. They need to be resolved, or at least let's decide to resolve them later. But also it's thinking about, what are all those positive things that maybe overshadow some of these unresolved conflicts. But again, conflicts are part of a relationship, and it's whether or not we can resolve them. So, we think about, what are options? Cognitive therapy. Let's think about conflict resolution. Let's think about how to flip these ideas. I have a favorite book that I brought tonight. I just want to show you guys. It's called 8 Dates by the Gottmans. And so this book I learned about. I got to marry a couple last summer, which was such an honor. And I walked the couple every weekend through one of the 8 dates. And we talked about each one of these things. And then they went off and had the date. And these were 24-year-olds who really have their heads screwed on straight. It was an awesome experience. And they said they fell in love with each other even deeper. And there's a wonderful chapter in here. One of the 8 dates, or critical conversations, is about intimacy. But the underlying theme of this whole book is about how relationships are built on curiosity and friendship, and how we can learn more about our partner. And so, this woman who had been married for 43 years, part of her pleasure was really getting to know her partner more and thinking about what they did for each other to feel good. So I think I rambled on that one a little bit, but this certainly ties into insufficient intimacy. So this tends to apply, let's say, to the busy couple with 3 or 4 young kids, or I have patients, same sex, they're both in very high-powered jobs, they're never home, they're traveling everywhere, they just don't have fun together anymore. Anytime that they're together, either one of those example couples, it's all about being roommates and who did what, and logistics, and who took the kids where, what place, when. And so it becomes where they're just not that much fun. It's just living together and getting through the day. So it's finding these little moments. And again, 8 Dates talks about, it's being curious, it's learning about the other's inner world. What are they thinking about? What makes them happy? What turns them on? And again, it doesn't have to be that sex is one more big deal. Can it just be that little stuff? Can it be holding hands? Can it be snuggling? Can it be just a quickie in the morning? Can it be taking a shower together? Can it be brushing your teeth together? Whatever it is, it's creating those daily bonds together that then allow for more sexual interplay. So insufficient intimacy, again, to treat this, how can you reconnect? What did you like to do when you first started dating? How can you make sure and schedule a date night? Schedule the babysitter in advance, so even if you're tired, you still have to go out because the babysitter's coming over. Definitely couples therapy is an option. And again, the Gottmans have written so much. I highly recommend the podcast with Brene Brown interviewing the Gottmans. It just really, when I first heard it, it just gave me hope about the power of friendship in an intimate relationship. So, Missy, do we have any other cards on that one, or should I show about this? I guess another one I would talk about is just lack of trust. Again, so much of intimacy is being vulnerable, and it's knowing that you can trust your partner. It's knowing that you're safe. And so again, if you personally have a real difficulty in being emotionally available, that's something definitely to address. So it's, seeking therapy for yourself, for the couple. and super important. So another question that I'll get a lot is, okay, what if none of these cards apply to me? I like my partner, we're intimate, we have lots of fun. I just don't want to have sex. I have good self-image, my estrogen's good, my testosterone's good, everything's good. But that switch just flipped. I used to have good desire, I used to have good sex, and now I just don't. So there's a name for this. And when I've talked to women about it before who have this, they often just cry with relief because, oh my gosh, I'm not broken. There's nothing wrong with me. And so it's called hypoactive sexual desire disorder. So it's when these symptoms have lasted for more than 6 months, they're persistent. Again, it doesn't have to do with relationship or self-image or pain. It's hypoactive sexual desire disorder, HSDD. And we think it's where that switch just gets flipped in the brain. And there are now 2 FDA-approved therapies for HSDD. One is a daily use pill called Addyi. Addyi is a distant cousin of Prozac or Lexapro. It was a medication that was initially studied for depression in women. It didn't really do much for depression, but it made them want sex. So it was then studied as a drug to treat HSDD. It was FDA approved several years ago. And I have patients who take it and find it quite effective. It works in about 60% of women. And if it doesn't work by 6 months, it's not going to work. But for some women, it really does help increase the desire. So women who want, it helps them want sex more and be more open to the subject. The other drug we have nicknamed the horny shot. The horny shot is called Vyleesi is the medical name, or the drug name. Vyleesi is a shot that women give themselves, and within 45 minutes, we joke, they're chasing their partner around the room. Vyleesi is a drug that can be used up to 8 times a month. The only contraindication is uncontrolled high blood pressure because it potentially could increase a woman's blood pressure. And it also can cause a side effect of nausea. So researchers thought women aren't going to want to give themselves a shot. Oh, they do. Oh, women aren't going to want to use a drug that causes nausea. Oh, they do, but hey, can I have a side of an anti-nausea medicine? So we have patients who take Vyleesi and find it very effective. So just to know that if you have HSDD, you don't have to suffer and you don't have to go through life with that switch flipped when you'd rather have better desire. So, the sex deck is certainly available on our website. It's available here at True. If you're a patient of True, stop by and pick one up. It's something that can be really helpful, again, to have a conversation with yourself and then hopefully to have a conversation with your partner. If you are not in the state of Michigan, if you are not here to come get one, feel free to get one from the website and take it to your provider. Again, sex isn't something that providers are trained in. Most docs, we just don't want you to ask because we don't know the answers, and that makes us feel very uncomfortable. So sadly, it becomes about us and not about you. So I would recommend that you take the deck into your provider and give them a second to read it. Maybe drop it off and say, hey, can you read this? And then I'll come back and we can address this. Thank you, Helen. That's awesome. So it's one of these things that can be really helpful to get the care that you need and get the attention that you need. Also, there's a website called Ishwish, ISSWSH, ishwish.com. If you go to Ishwish, you can find a provider who's a member of Ishwish in your area. And that means they've probably at least been to one of the meetings. I've been to many meetings. I've been to the teaching meetings. And again, I've learned so much. I sometimes have to put a filter on because it just is now so easy to talk about. So I really want you all to consider the aspects of sexual health and how this can make a difference. Now, I know there were lots of other questions that came in earlier. Missy, do we want to put these up maybe one by one? All right, cool. Here we go. So I'm 47 years old and have recently become sexually active again. Sometimes I bleed during and after sex. There's no pain during or after, and the bleeding stops later on. Should I get checked out? Of course, if bleeding doesn't make sense, always get checked out. So some things I think about. So as I would ask you questions about this, I'd say number one, what are your periods like? If you haven't had a period in, let's say, a couple years, you had early menopause, I would worry about postmenopause bleeding, and I would want to get an ultrasound to check the lining of your uterus. I would then, of course, want to do an exam, and I would look at the skin on the outside. Is that really thin? Is it cracking? Is it bleeding? I would look at the skin on the inside of your vagina. Is that cracking or bleeding? I would look at your cervix. I want to make sure your pap smear is up to date and we're not worried about precancer or cancer of the cervix. I've had patients who have been diagnosed with cancer of the cervix because they had bleeding after sex. But again, I'd like to think you've had your pap smears and that's not the issue. So I would want to do a pap smear. I would want to do an exam. For some women, it's maybe they've had a long-standing bacterial vaginosis. They're just an overgrowth of the wrong bacteria in their vagina. There's a lot of irritation on the cervix. So again, I don't want you to be afraid to get checked out. This is something that generally is minor and can be resolved quite easily, but definitely should be checked out. I've had patients who have had polyps on their cervix, which are generally benign. They're not cancerous. It's just a growth on the cervix that can bleed really easy when it gets touched. And so again, yes, you should get checked out, but please don't worry or be stressed. It's something generally a gynecologist can easily figure out and help you with. Okay, another question. It's been 2 years since my last period. Is it too late for me to start hormone therapy? I'm worried about risks, but my dryness is making me crazy. So hormone replacement therapy is way safer than most people think. Certainly if you're not in Michigan and you're not in Michigan, I would want you to see a certified menopause provider. So you can go to the website menopause.org and see a list of certified providers who are in your area. So a certified provider is going to know the rules about who is estrogen safe for. So for most people, it is safe to start estrogen within 10 years of the last period. So if it's only been 2 years, you've got lots of time. There are certain things that might make it a contraindication, meaning maybe it's not as safe for you, but again, pretty rare. So questions I ask my patients, have you ever had a migraine with blindness? If you've had a migraine with blindness, it could tell me you have a relative increased risk for stroke, and I would not want to give you an oral synthetic estrogen. I'd want to use a transdermal or a patch estrogen or an oral bioidentical FDA-approved estrogen. So I would ask you, have you had breast cancer, of course? And so if you've had breast cancer, I wouldn't recommend estrogen that goes in your blood, but I might recommend estrogen that goes in your vagina or DHEA that goes in your vagina or the Mona Lisa laser. So all those things will treat dryness related to low estrogen. So bottom line, it's not too late, but definitely see a provider who's certified and knows the rules to make sure that it's safe. A question, I'm only 25 and I feel like I'm having a lot more dryness. Do I need to go to the doctor? So of course I'm going to say yes, you need to go to the doctor because this isn't normal. But generally the treatment is really awesome. Let me back up. My brain and my mouth are, so I'm only 25. So if you're having dryness, I would first think about the skin on the outside of the vagina. So a lot of times on the outside of the vagina, there can be a skin condition called lichen sclerosus. Lichen sclerosus is kind of like eczema, we jokingly say, of the lady town. So it's eczema of the lady town. So if you have eczema or lichen sclerosus down there, it's an autoimmune skin condition that can cause dryness, itching, burning. The skin can get so thin that it can split during sex. And women often will say it feels really dry, but actually that lichen is making the skin so thin that it tears during sex. And long-term untreated, it can increase your risk of skin cancer in the skin, in the vulva, and the labia, so in lady town. So it's one of those things that I would want you to see a provider who's trained in lichen, because 15 years ago, before I was trained, I didn't recognize lichen until it was very severe. So you want to see a provider who knows about lichen and can recognize it early. It's very treatable with a steroid ointment, called clobetasol. Dryness on the inside can happen if you're only 25. For example, if you're on the birth control pill. So the birth control pill can really reduce your estrogen to very low menopause levels, to where your estrogen level is so low that you have vaginal dryness related to low estrogen. So especially if you're 25 and if you're on the birth control pill, that can cause dryness. Let's say you're a woman who's very thin and maybe you've had calorie restriction or you've had an eating disorder and your body mass is very low. Sometimes that can also cause your ovaries not to work well. You don't make a lot of estrogen and that can make you feel very dry. So again, this is very legitimate. And again, most women I see with this condition, they're on the very low dose birth control pill. And so what often we'll recommend is get off the pill. Let's find another method of family planning if that's important. For example, an IUD. We'll let the ovary start working again. There is no other way to raise your estrogen other than get you off that birth control pill. So again, I'm so glad you asked this, and please let us help. And I see Helen mentioned, go get the Mona Lisa laser. Love it. So again, it can be very helpful, and we're so excited to offer this here at True. This woman says, what do you recommend for extreme vaginal dryness and pain? I have a hard time with creams and getting them applied properly and timely. So to treat vaginal dryness, number one, there's always the Mona Lisa laser. So that works without creams or an insert or hormones in the system. And the Mona Lisa laser can be used your whole lifetime. The Mona Lisa laser, I'll talk about real briefly. It's used with 3 treatments in the first year. So again, it's FDA cleared. It's not FDA approved for a certain indication, but there's a lot of research around this. I really want women to see the research if they want to see it. We actually have the papers laminated so you can read the research yourself. The Mona Lisa laser is very effective. By the end of that 3rd treatment, it's as good as estrogen, and then you just need 1 treatment a year thereafter. If that's not something that you're interested in and you want to try a hormone medication, number one, the creams can be messy, but for some women, it's the only thing their insurance will cover. So for example, I have many women on Medicare. The only cream that their insurance will cover is called Premarin. So Premarin is a synthetic estrogen, or it's from purified horse urine. I know that doesn't sound appealing, but back in the 60s, that's all they had. And it's very effective. It's been studied for years. It's very safe. And again, it's just using the right amount. The only problem is the cream has a lot of alcohol in it. So if your bottom is really dry, I might say, let's use a little coconut oil first, just in terms of skin not being so raw. And then the trick is using 0.5 gram. Now, 0.5 gram, what is that? You'd use the applicator just to measure out the amount and put it on your thumb just to show how much it is. And so what I recommend is you put the cream on your thumb, put your thumb in your vagina, push down and rub it in like lotion. That's the best way to use it so it's not drippy, it's not messy. If you use the applicator, it gets stuck in the applicator and then the applicator's messy and it's kind of gross. If you use the applicator, just rinse it out with hot water in between uses and you can reuse it over and over. So, that's the deal with a cream. When you first start with a cream, it's really important to use it every day for 14 days and then to use it twice a week thereafter, and you can use it your entire life. It not only helps with dryness and pain, but it also helps reduce bladder urgency. So you don't have to get up every 2 hours during the night. You can actually get a good night's sleep. And it also reduces bladder infections. And so it can be really important. There's another medication that often I recommend over the creams because it's not as messy. It's called Imvexxy, Imvexxy, Imvexxy. I'm sexy, Imvexxy. So Imvexxy is a little insert that is bioidentical estrogen, FDA approved, dissolved in coconut oil, put in the vagina. It has gelatin in the capsule. And so it sticks to the skin and then it melts. And so the coconut oil spreads. It's like a good, nice lubricant. And then the medication gets into the vaginal skin and helps with all of those symptoms: dryness, pain, bladder infections, and bladder urgency. So it's good stuff. Another option is a medicine called Intrarosa, which is vaginal DHEA. That's FDA approved. It's approved for painful intercourse. And it's a suppository that's a waxy suppository. It has the prohormone in it that the cells in your vagina can use to make estrogen or testosterone in those cells. And it can help with arousal and orgasm and get rid of pain and dryness. So there's lots of options. Make sure that you see a certified provider. Of course, anyone here at True can help you. Or if you're out in the world and not in Michigan, then to see a provider who knows what they're doing. My sex life was fine until menopause, but I'm just not interested anymore. Could the hot flashes I'm having affect my libido? So again, going back to the sex deck, I can, think about how many cards that apply to this. So number one, low estrogen can really affect the desire center in the brain. We think about the brain having like accelerators. Estrogen is one of those accelerators. When a woman's in menopause, she's not making as much testosterone either, and testosterone can be a driver of sex drive. And so the hot flashes can affect you because maybe you're really distracted during the day, or if you start to be intimate and you're touching skin on skin and you get another hot flash, well, that's not any fun. Let's say that you're up all night with night sweats, and so now you're exhausted because you haven't had a good night's sleep for 2 months. The last thing you want to do is have sex because, like, oh my God, I just need to go to bed. And so lots of things could come together to affect your libido. So again, it's the spontaneous libido where the hormones are affecting your even thinking about sex. And then it's all those other things, the dryness, the hot flashes, the fatigue that are causing low responsive desire. So I hope that helps, but yes, very much that can be an issue. Missy, are there any other questions or is that it? So since there's no more up, I'm assuming there's no more questions that came in. I sure appreciate all of you being on tonight. I sure hope to see a lot of you here next week at True in our lovely facility. We just love our office here to talk about the Mona Lisa. We could talk about prioritizing your pleasure all night. And I look forward to having this conversation again. If you have questions, of course, that are personal and you want to talk to us here at True, all of us here at True are comfortable talking about these subjects, and we're happy to help in any way that we can. So just want to make sure there's no other questions that have come in. Oh, you're welcome. And another thank you. So again, this is just such a pleasure to be here. I'm so honored that others have gone before me and done the research and done the education that I've been able to learn so I can share this information with you. At True, our goal is to reach as many women as possible. So please share this link with your friends. We want to spread the word and get people comfortable talking about sex and pleasure and intimacy. This world, we need more love, right? Like John Lennon sang a song about that, right? We just need more love. So again, I wish you the best. Stay safe, and please prioritize your pleasure.